Hey everyone, and welcome to a very special episode of Quick Hits. That's right, we finally got our own clip show. This week, we're taking a moment to reflect on an incredible year of conversations, breakthroughs, and insights about, you guessed it, AI. From its impact on healthcare innovation to the ways it's transforming how we work, live, and connect, 2024 has been a year full of thought provoking discussions and amazing guests. Before we jump into today's highlight reel, Tyler and I want to take a moment to say thank you. Thank you to all of our wonderful guests who've shared their expertise, their stories, and their ideas with us throughout this year. Your contributions have truly made Quick Hits a space where innovation thrives, and we're having some very important conversations. And of course, we can't forget about you, our amazing listeners. Whether you've been with us from the start or you're just tuning in for the first time, we thank you so much for your support, your feedback, your suggestions, and of course, your curiosity. You're the reason we do this, and we couldn't be more grateful. So today, we're bringing you the best of the best, a highlight reel of our favorite moments, expert takes, and game-changing ideas about AI from the past year. So sit back, relax, and enjoy this special episode of Quick Hits. We talked about drones. We're talking a little bit about the future, and I get excited when we start talking about the future. Um, what do you see next for the healthcare industry? What are you excited about?
With generative I think we're starting to see all of our software partners embed some sort of Gen AI solution natively within their applications. It's usually the EHR, it's their ERP, it's obviously their diagnostics, and then there's usually a platform system for IT. And they want to, where possible, make sure that most of the workflows for the enterprise and the organization can be accommodated through those systems. And those are the software partners that we then work with to make sure that they are continuing to leverage the new technology that's available in the market, like Gen AI and others, where those platforms can help us elevate from our current state of operations to what the future will hold. Unfortunately, I don't think the financial pressures are going away anytime soon, at least in the next couple of years. While I do think the phase will pass, but I think the way the phase will pass is not just because all of a sudden cash will be made available. I think it's going to be adoption of these new technologies that will significantly change how much effort we need to put in for mundane tasks. We will expect technology to do a lot of what we do today. And then I think we are going to have to elevate our skill sets. I've been talking to ServiceNow, our ERP, which is N4. Epic's already working on it. We're actually piloting a way to have Epic automatically draft in-basket responses for some of
Wow.
our providers. We're
Hmm.
piloting in some specific areas. I think that's really going to be really exciting. EMR implementation was great, but we've added all these burdens to providers who then have to respond to messages at, they call it pajama time because they're done with their clinics. So that's an example I can think of in Epic. And the Infor, which is our ERP, in the Infor space, or for that matter, any ERP, there's probably a tremendous amount of opportunity, and I don't think the ERP space is quite there yet in looking at the finance, the accounting, the budget process, the supply chain process, predicting inventory levels, based on seasonality, what's happening in the region, maybe even based on where you are located and within the country, and helping do some of that analysis automatically and not needing humans to
Hmm.
spend a ton of time to
Mhm.
get that same insight. And then ServiceNow, which is what we often refer to as a workflow platform, we're doing a lot with them these days, and they will be able to really summarize an entire story of all the things that have been documented between that employee and the IT team. And so when an analyst who may not be, I mean, this is actually a great thing for you guys as you augment staffing across
Hmm.
different organizations. Your consultant may join one of the IT teams and they may be expected to work their tickets in ServiceNow with how ServiceNow is planning on leveraging Gen AI technology is your consultant will be able to hop in and they're gonna have a little summary of everything that's happened on that ticket over the last
Wow.
you know 4 or 5 days. So you don't really need that background of the handoff from that analyst that worked on it and now is handing off that work over to you.
Right.
So being able to absorb all that information through language models and presenting it to you in including what is again a term that's becoming quite of an industry common term is the
Mhm.
next best action
Mhm.
is what a lot of these softwares are working on.
All right, so Ron, we hear a lot about artificial intelligence these days, and I know that Nebraska is cutting edge in the early adoption of Nuance Stacks product. But I actually want to take this question a different direction, and maybe if you can help us understand how artificial intelligence can or cannot really improve interoperability.
This is a good question, Tyler, and I think that AI is going to be more impactful than just from an interoperability perspective. It's going to affect the full continuum. And it's also a funny topic because a lot of people feel like that AI is just a buzzword at this point and they feel like nauseous every time someone mentions AI. And I don't disagree with that necessarily, but I don't have the same heartburn because AI hasn't fully matured into being true intelligence.
Mhm.
I think at the end of the day, it's artificial. We're simulating parts of human thinking. We're not simulating the entirety of human thought and rationalization. Um, so, where do I think it's going to be important when it comes to interoperability? I think there's some really neat things that are possible today where you can take some of the traits for a patient that you're seeing, send that data out to a data lake, and then compare it to other traits of patients who've got similar presentations. Then you can, one, find patients who look alike and help clinicians be able to connect with each other and collaborate on care now, where those clinicians may not have even realized that they were dealing with really rare traits in patients that they were seeing in different parts of the country or different parts of the world. The other thing that I think is going to be really cool, and again, is within very easy reach, is being able to compare treatment outcomes on patients with similar presentations. I think a world where a clinician is inside an EHR looking at their patient, getting ready to prescribe a medication, and being able to see what the outcomes of that medication compared to three other interventions has been is a very powerful way to inform clinicians about the care that they're providing. It can, and it becomes more of precision medicine, or even, there's a lot of talk about digital twins as well. And this is a simple way to start creating digital twins is patients who look similar, have similar presentations, who have similar risk factors, and be able to start predicting what the outcomes of treatments may be based on how other individuals responded to some of those treatments. And that's only made possible by having uniform ways of exchanging data, talking about those data points, and then comparing those data points.
Why is AI or AGI and machine learning so important in the healthcare space?
If you want to do AGI or if you want to do machine learning or you want to play with generative AI, the compute power is important. And the compute power could be CPU, could be GPU, could be TPU. All those are important. And the only place you can do scale is the cloud, not in your basement, unless you own a supercomputer. Why is it important? Why is not important? The question that you are asking is very simple. uh, Single most important thing in the world is trust. It's very hard to gain trust in the day and age that we live in. the hype started with generative AI, and then all of a sudden everybody got interested in AI, trying to figure out that how do we benefit uh, from the vast data that we have. I'll give you one more specific example, that trying to find a cure for certain diseases. Drug discovery, artificial intelligence is a very good tool, from machine learning to artificial intelligence, that it allows you to find new drugs, new ways of treating things. So that's a new data that is generated.
When does that new data eventually help with the predictive modeling, or will the two forever be separate?
So let me walk slowly. Predictive modeling is beginning, and new and artificial intelligence using that new data as the end, so that you understand. A new data cannot happen without machine learning, and without having all different types of data in place, without your biases, and there's a lot of ethics behind it too, that we are all afraid of. And trust me, the machine is not taking over yet. So it's a long journey. Everybody thinks everything will happen in 5 minutes. It's not happening.
Yeah, Dr. Rob, it's great to hear you kind of dispel these myths. Yeah, that everybody can afford it, that it's coming so quickly. Ballpark, over the next 10 years, what do you expect will get adopted in healthcare? And how close will we be to AGI at the end of 10 years, too? I'll just throw that in as a secondary question.
So your question is right on. So what is the so presently everybody's hyped about generative AI. So I'll start with that. See, the thing is, we are thinking that the machines will become human-like. In my mind, that is far away. That's not here. What machine can do today and go forward is coordination with multiple agents. It can talk to 4 or 5 people. It can do creativity. It can do some logical reasoning and problem solving. It can do natural language generation, natural language understanding, output articulation and presentation. These are things are possible, and it'll take at least 10 years to perfect it. Because here's the thing, we still have to have guidelines. Uh, the president has set up a group of people to follow ISG and a couple of other institutions to follow certain safety guidelines. The European Economic Commission and European people are also coming with the guidelines to follow behind it. So if you're asking, that LLM will become very popular for medical world, and use of artificial intelligence will become popular after we have taken care of predictive modeling. The third thing that's coming is clinical decision support. So the FDA will govern that, because you can't do harm to other people. So safety measures will take about, in my mind, 3 to 5 years. Initially, I was also part of the hype, and to perfect it will take 10 years. By which year is this? 2023. So by 2030, we'll be in a better place than we are together today. But at least natural language processing, LLM, coordination with multiple agents, and creativity in place. What you will see the use of automation. Technical automation will come quickly. What you will see in healthcare, that agents that we use, that will come quicker. What you will see is that will not only use text, but it will help us in code generation,
Hmm.
in image, especially with the new tool SOAR that came out, that generates a 1 minute video by your text. If you say a text, a tiger is walking in Dr. Rob's house, it will generate a video based on that. Audio will be used, and 3D and video, they will be used faster and quicker, in my mind. In healthcare, it will help us make our revenue better in the next 2 years, 3 years, because people will move from predictive modeling to generative AI, and there is a place for generative AI. People are using LLM models and generative AI. The true use of AI for R&D and other things, that's about 3 years away, because safety measures have not been taken care of yet, and the policies and the rules have not been finalized, because those are very important. While outside the United States, people are doing a lot of things that they're supposed to do, the biggest thing that you will find out is research and drug discovery, customer documentation generation, and also you will find marketing will be an advertisement will go faster than anybody else.
Right. And that's a conversation we've been having quite a bit lately on the podcast, is talking about AI and its role, but making sure that it's trained on the right data. But with AI, like, who do you think is leading the charge in helping the AI engineers, because most of them don't have a medical background? Like, where's the connect there? What efforts are being made there, do you think?
Yeah, I mean, I have a real concern about that just because, we're at the place we are at with many other health technology tools because of a lack of engagement and multidisciplinary team based work
Hmm.
on how to design things. And, I believe that it's really important to participate in HL7 so we can make sure all the voices are represented. But I also think from a design perspective of anything, it's important to make sure that all of the stakeholders are represented. And so when people talk about, oh, our tool helps with health equity, then I say, oh, what people who represent health equity groups did you have in the room when you designed your tool? And if the person can't answer that, I think you always need to sort of step back for a minute and think, do I need to get a group of those people and now look at this thing so that we can see whether or not it actually meets those needs? I mean, I think if you get a group of physicians in a room and show them a lot of health IT tools, they can tell you right off the bat if any clinician had a role in the design. And I think most people would sort of scoff at the idea that that's a routine practice in the existing kind of health IT space, just because of how unintuitive some things seem and how they don't really seem to match or meet the needs of the user. In terms of, making sure that the future is going to be different than the past, I think we have to sort of bang on a pot lid or something really loud about the engagement of patients and care teams and the development and the surveillance of this work. And I think it's really critically important that there has to be more accountability for the organizations that own and in many cases make quite a lot of money off of the backs of the healthcare workers who have to pay for those things, in being accountable to responding to all of these concerns.
I guess one of the other challenges that we've seen in the healthcare industry is with interoperability. I think you would agree that that is still a significant challenge. What advancements have you seen so far that you think are encouraging, and what are you thinking will push that even further?
Can I answer that with a rant?
Absolutely, that's what we're here for.
One of the biggest shortcomings I think that as an industry we have, healthcare technology, is that we build all these customized systems ourselves, right? Everyone has their own instance of tech, and no health tech company, let's be honest, is ever going to scale to be able to have the level of investments that a big tech player is going to have. It's just not going to exist. And so instead, we have to go through this continuous battle of, well, we built this customized technology. And of course, now this customized technology doesn't speak to the other customized technology that we've built. What a surprise. And know what would really help interoperability if we just stopped having the ego to do that, took a step back, and like every other vertical software industry said, hey, let's just use what exists. Let's take the core base systems and then build some
Mhm.
customizations on top of it. Like, look at the most successful health tech company out there, Viva. Viva didn't build their own CRM. They took an instance of Salesforce. Why would they have to go and
Mhm.
build their own? They just build a customized platform. Only now are they saying, well, let's go get our own customized version because we've scaled and we're the dominant industry player, and maybe we want to have a little bit more of our own control of our
Mhm.
technology. That was many years after their founding. And so I wonder if that's the big limitation to interoperability. Now, Randover, I do think advances in natural language processing and Gen AI, both of those should help unlock a lot of their data. I think the issue also with healthcare data is patients are unique, right? So you can't just say, oh, let me have a generalized code for each of these instances. There's a lot of writing that goes into it. And that writing means you have a lack of harmonization. And so the more we can have some NLP applied to that, the more you can create at least some backward standardization that can get this into a better spot.
How do you see companies best, addressing the growing demand for AI-driven automation? And what are the key factors that you've seen where it's really been successful in implementation?
I mean, it'd be impossible to talk about this without talking about nuance. I think they have done such a phenomenal job in an area of medicine that every doctor hated. They should just take a process that they already hate, such as note taking, and just get rid of it. Just not have it be a part of the process. And so I think that's probably the best component of it. But just as much as doctors don't like the note taking, I do think there's a lot of other areas of medicine that need to be improved with LLMs. I think about the call center work, right? Have you tried calling your hospital lately? Have you like really had the misfortune of doing that? Whenever you go to this main routing center, there's this person with a switchboard. Hey, I'm looking to reach this department, this nurse. Oh, okay, let me forward your call. You get forwarded 4 times. There's probably a lot of automation that can happen there. I also think about the back end call center work, a lot of billings. How much education do you need in order to just go and relay that in a digestible way to the patient and the consumer? I think that can do a lot in order to get it moving a little bit more forward. I will say, and this is so keep in mind, I'm a futurist, and some of these ideas maybe are a little bit crazy. But I do think there's not enough doctors, especially PCPs in the US. So while most Gen AI applications today are all around how can we reduce the friction in doctors' everyday processes, I wonder if ultimately it has to go and make the leap from admin work into clinical work.
Let's talk AI. And I know you kind of teased on some of those areas, but I guess maybe more specifically, you mentioned something about unit cost, and curious to how you see the life cycle, and when you think that, or what tools or piece of technology, or kind of where we are in the life cycle that that AI maybe will enable true return on investment.
No, I think there is a return. So I don't want to be so glib to say that it hasn't reduced. I think the reality is that we can't capture some of the probably most pricey parts of our unit cost, and that's our labor. Obviously, the value of that goes up the higher the cost for that staff. The more efficient we can have with all of our inputs into our system, the more efficient we're going to be, and I think the better product we're going to serve the community. So I think that's essential. And I think you have to take a broad view of how you look at those costs and the impact that it's having on your system. So Epic was a classic example. It was higher priced than its competitors at the time, but we believe the value of both the integrated model of the ambulatory and inpatient modules and the modules that could be added to bring on other functionality was the most integrated that was out there at the time, from our opinion. And the board made a decision for not just the Yale New Haven health system to deploy universally a single instance of Epic, but also the medical school. And for in Yale New Haven's situation, Yale Medicine is a separate corporate entity under the university, but we have an affiliation agreement that's dated back, forever. And we did it together. And so, technology was important, but I would say what was equal or maybe even more important, in my view, substantially more important, was actually the initial decision for Yale Medicine and the Yale New Haven Health System to do it together. Because what that has spawned is a new strategy, which I've adopted since I became CEO, which is alignment with the school. We're doing more and more, right? Far more than Epic, but Epic was a building block to that. So those are things that you can't put a value on, that actually Epic was the instigator for that work. And that was now 15 years ago.
That might be a new record for AI being brought into the conversation. Thank you. I mean, we love talking about it, but so when we look ahead, right? What do you see as the most promising development in healthcare IT? Let's say over the next 5 to 10 years, and then specifically for Stanford Healthcare, how are you guys positioning yourself to lead in those areas? What are some of your current initiatives that you can talk about?
It's a great question. If we go up 50,000 feet, right, the idea is that we improve patient outcomes with health IT, continue to improve patient outcomes with health IT, and reduce costs, which we haven't been as successful at. And so if you then begin to come back down to earth, all the capabilities that we now have and will have around artificial intelligence, I think really does take us from the digitization era of healthcare to the digital era of healthcare, where the systems, the platforms, the data really begin to work for the clinician and the patient in new ways. I can only imagine, what it's going to look like in 5 years as we see, generative AI models just exploding in their terms of their capabilities and function. So it's really, really exciting. I think we start more with automation. So what are the tasks that our clinicians and patients are doing now that could be done by computers? So it's not necessarily creating new capabilities, but really taking away the things that we can automate. So for example, listening to a patient physician conversation and drafting the note. Huge win. We've got that live now with over 250 clinicians who are loving it. And we're looking at things in terms of patient messaging and the revenue cycle, and the list goes on and on. But those things are really going to provide value up front because it's giving back time to people so they can use it to better think about patient care. So I think, that's where we start. And then we really move into precision medicine at scale, which is leveraging large data sets, clinical decision support in real time, specific information about patients, including genomic variants and social determinants of health, to really start to provide truly personalized medicine decisions. And that's really, really exciting. If you think about it, we have randomized controlled trials that are really fantastic on how we think about what to do in medicine. But in the end, they're averages, right? On average, these patients do better. And so the question is, well, how do you really get to the point where you know which patients do really well and which patients don't, and choose a different therapy or treatment plan to much more focus on individual patient decisions?
Yeah, I think, well, I've been reading a fair amount of Hemingway recently. So when you're talking about cutting, it's almost like we're in this era right now where we're cutting, and you're cutting out tasks in order to free up the provider. And that sounds to me, Dr. Pfeffer, like where we're at. So we'll call it like the Hemingway era. And then the next era seems like that true science fiction era. Like we're actually going to be doing different, or the work truly changes. So I know we put in some timestamps here. How do you, if you will, do you have any way you think about the timeline we're at, and when we start seeing that personalized approach, and how long we stay in this current stage where we're just trimming the duties that maybe were a product of the digitization?
Yeah, it's a great question. I think that we're going to start to see these augmented approaches where, the clinician plus AI can do things that neither can do alone, start to really ramp up over the next few years. We have to make sure that these function safely, ethically, they're monitored, so that they continue to provide the right support and right decisions, basically. I think we'll see a lot more automation happen during that time period. So if you think about two curves, you could think about the automation curve with a very steep slope and the augmentation curve with a much kind of lower slope, but then will start to really increase over time. The other thing that's really interesting is the automation tasks are going to get us better little data. And everybody talks about big data, but big data is a bunch of little data. The little data isn't good. And the big data is really not good, right? But if we're recording and transcribing the actual conversation that happens between a patient and a physician, and we're incorporating better data around genomics and social determinants of health, just imagine how good the big data is going to be.
Right.
And that is going to change things. I mean, there's lots of observational studies. One that said we should all take aspirin, and then that's debunked. So observational, studies are based on, large data sets and following people over time. But you can imagine that as the little data becomes better and better and better, we'll be able to make even better predictions from the big data sets. And I think that's going to really be able to drive precision medicine at scale in new ways.
Nitu, it's awesome to chat with you. And, when you're talking about launching Epic out of Apple, it makes me think a lot about when Excel and Word were available out of Apple, which was a big turning point, in the Microsoft Apple wars back in the day. But there was another comment that you said that I found really fascinating. You essentially were using computers and technology, but then when you were trained in medicine, it was still in the paper world. And so you moved out of that. And then you were around when we did the big shift. What I'm curious is, as now technologies like Abridge and DAX and Ambient are available as this next generation of physicians is being trained, how do you see that affecting the practice of medicine and actually how clinicians are learning to practice medicine?
Great question. And we dwell on that quite a bit, and not just for the clinicians, but also for the trainees. As an academic medical organization, we are responsible for training the next generation of healthcare providers. So it is a huge part of how we discuss not just these technologies, but others as well. Are we enabling the clinicians of the future to understand and use these technologies and tools responsibly? We never send a physician out into the world to practice without knowing what a stethoscope or what an ultrasound does. And we shouldn't be sending them out without understanding what these technologies offer and where they are reliable and where they should be used with caution. So it's a huge part of what we think about. And I know I gave away my demographics a little bit when I said we still were written on paper when I was in med school and in residency. But yes, we all learned to pivot. What I also saw happen in the past 2 decades is that the people who were efficient were just efficient no matter what you gave them. It took them a little time, but they figured out their way, and they know how to make the flow work. And the people who couldn't get the workflow on a paper also won't be able to do very successfully in an electronic system. If you take bad practices from the paper world and you hardwire them in an electronic world, but now you've hardwired it, there's no give. So you'll see good practices get magnified, and so do the bad practices do. And those are the kind of things that we watch out for. And that's how, in some ways, the field of informatics evolved and started. We sit at the area between medicine and technology, that's clinical informatics. And that's part of what we do, is how to make technology best serve the clinical mission of the individuals and the organization. And that can take many shapes and forms. But the key is, how do you learn newer things? Because these aren't the only things. Like, when did we all get exploded on the marketplace with generative AI technologies? I think it was November or December of 2022 when we started to hear about those things. Those of us who've been using predictive models and AI for some time, even we were excited about it. And we certainly saw the hype cycle, and now it's a little bit of leveling off. there are every day newer things that are happening.
Yeah, so Nitu, looking ahead, what emerging trends in health informatics do you believe will have the biggest impact on the future of our ability to deliver great care to patients, as well as taking care of our precious resources of physicians and clinicians?
Good question, and a very timely one. And I will tell you, this will also show my bias as a tech affiliate. So, if I say my first thing that comes on the horizon is um, artificial intelligence and generative AI type technologies, we're already seeing them, much like in every other industry. There's a lot we can do. We are a little bit more cautious than some other industries might be because we have lives and health at the other end of it. So, a lot of where AI is being applied is where we're seeing busy work happening, whether it's on the operations side by staff or by clinicians. I mentioned ambient listening as one of those examples, but there are other examples where AI is being applied. Also, as an education institute, things like is information retrieval getting better, or are we training our trainees with the right tools, keeping in mind that the job market they go out to might require different skills. So that is a game changer in a lot of different ways, including research on it and by it. And then the caution that comes with it is, the usual things people talk about: hallucinations, authorship rights, copyright privileges, and so on and so forth. So yes, I'm so cautiously optimistic in that this will change healthcare in more ways than we can imagine at the moment, compared to some of the other technologies that have come in the past 5 to 10 years.
So let's talk a little bit about Notable. As the chief medical officer at Notable, what are some of the most exciting projects that you've worked on in the past, or maybe that you see coming up when it comes to healthcare automation?
Yeah, so at Notable, our mission is really all centered around how we remove burden and administrative friction from healthcare systems. So anybody who's spent time in a clinical practice or in the hospital knows that so much time, effort, friction, and waste exists in the healthcare system around administrative tasks. And so, whether that's working work queues, answering phone calls, faxes coming in off the fax machine, dealing with prior authorizations, there's just an immense and growing amount of barriers and friction in between patients and providers being able to, for patients, get the care that they want, for providers, deliver the care that they want to give. And so Notable is all about removing that friction, removing the barriers, and shrinking the distance between the care that care teams want to provide and that they're able to deliver to patients. And so we do that through AI technology that helps automate workflows. So anywhere you go in a healthcare system and you see people kind of, banging their heads against a table, doing repetitive work over and over, and you wonder, why is it that humans are doing that repetitive task? Those are opportunities for Notable to come in to augment and support existing workflows and the workforce, and help them get their work done faster, and help patients get the care they need. So a couple of examples. So we do this for value-based care organizations. If you think about the work, value-based care is a very human, labor-intensive process to do well. Well, why is that? Well, it's because it takes an army of humans to review and scrub charts to identify the health maintenance activities, the care gaps, the cancer screenings, et cetera, that patients are having and whether they're up to date. It takes an army of humans to do outreach to patients to help close those care gaps. It takes an army of humans to scrub the charts for risk adjustment and to do proper coding. It takes an army of humans to reach out to patients about care management and program opportunities, that diabetes prevention program that they want to enroll in. And so every step along the way, there's opportunities to automate those workflows, automated chart reviews, automated outreach to patients, automated offers of care management program enrollment opportunities. And so very passionate about the work that Notable is doing there to support value-based care organizations. And if you look at organizations that are primarily fee for service, it's the same thing if you think about the referrals and patient access process. So everything from the referral coming in on the fax machine to the authorization being done to the appointment being scheduled to the pre-appointment intake takes just an army of getting through an army of humans to get through all of the friction and the steps in the workflow that exists today. And so we serve to automate those tasks and very passionate about what we do there.
What about since COVID-19 or even during COVID-19? How did you see things change or the attitude toward automation or even AI? How did that change from your perspective before you joined Notable? Because you said it was 2023 that you joined Notable?
Yeah, 2023.
Okay.
So I think, as we all saw, the pandemic was an accelerant for digital health. There were many use cases that were sort of sitting on the sidelines waiting to be given a chance that moved forward very rapidly during COVID. Obviously, telehealth took off. A lot of different patient engagement technologies took off. I think stepping back from the pandemic, though, the macro trends that we're seeing across the ecosystem are more concerning, more troubling, and I think more important for us to focus on. So if you look at the aging of the baby boomer population, so we're seeing the population age, more chronic conditions are being accumulated. So we're facing an older, sicker population of patients in the United States.
Mm-hmm.
At the same time, also again, accelerated by COVID, but not just through COVID, burnout among care teams. We see nurses leaving the workforce. We see 2 million open administrative healthcare jobs across the country that are unfilled. We see providers leaving the workforce. An estimated, I think, 20 to 25% of primary care providers leaving the workforce over the next 5 to 10 years. We see articles recently about physicians wanting to work fewer hours. So not only are more physicians leaving the workforce, but those who are staying in the workforce are working fewer hours than in the past. And so you have this tsunami hitting the country of more older, sicker patients and fewer care teams and fewer providers to take care of them. And so the way I look at the what's facing us with artificial intelligence is it's not going to be a nice to have. It's not going to be a nice thing that we should do. It's going to be an imperative, because the only way we're already seeing care teams today struggling to keep up, suffering with burden, overwhelmed by the amount of administrative tasks they have to do to take care of patients. And that's for, panel sizes of 2,000 patients per primary care doctor. What happens when we have fewer primary care doctors, patients are sicker, and we have more patients on Medicare? How are we going to take care of that population and deliver the experience and the access that we all want to?
When you talk about automating these points of friction, what's the approach from Notable? How do you determine what can safely be automated?
Yeah. So, I'm as a good informaticist, I think of life as a series of 2x2s to help prioritize things. And in this sense, I think of the 2x2 of sort of risk versus impact. So what are the things that we can do that are going to have the highest impact, the highest value for care delivery, and the lowest risk? Because we can all think of things that might be really cool to do. I was talking with someone earlier today about AI diagnosis.
Mm-hmm.
Sounds really cool. There was so much focus there, 10 years ago in the AI space, but that's not actually the problem facing doctors today. So maybe not the highest impact and super high risk.
Mm-hmm.
However, turns out there's a lot of things we can do that will have incredibly high impact and are pretty low risk. So faxes coming in on the fax machine that comprise referrals to specialty care. Every minute, every hour, every day, every week that those referrals are sitting on the fax machines, patients' care is being delayed. Their ability to see oncology, their ability to see cardiology. It's a pretty low risk thing to do, to use AI to transcribe that fax, get it into the EHR faster, move it through the system and the work queue faster. So
Sure.
high impact to patient care and the business, because healthcare organizations are paying dozens of people to literally transcribe those faxes into the EHR. Low risk. Prior authorizations. Every single, if you look at work queues, we looked at a healthcare organization last week, 7,000 active work queues for administrative tasks in their EHR. So that includes revenue cycle work queues, that includes authorization work queues, that includes scheduling and referrals work queues. I loved in Eric Topol's last book, he had a quote that was something like, we don't need AI to cure cancer. The opportunity afforded by AI is to actually restore the trust and the relationship between the doctor and the patient. I think Eric got it exactly right there.
Thanks again for listening to Quick Hits, a healthcare technology podcast for healthcare technology professionals. Follow us on Spotify or Apple Podcasts, and don't forget to reach out to us with feedback, suggestions, or even people in the healthcare technology industry you think we should interview. Send an email to quickhits@healthdatamovers.com.